Assalamu alaikum. This is the final clinical session in our clinical sessions series. Today we will talk about the insertion appointment of removable partial denture. What we should do is to insert the prosthesis and make it as comfortable as possible, teach the patient how to use the prosthesis, and instruct the patient how to maintain the prosthesis and the oral cavity. So what to do at the insertion appointment? There are a few clinical steps that we should follow, starting with the inspection of dental prosthesis before the insertion, then assessment of acrylic denture base adaptation. After that, we do assessment of peripheral extension of the denture base, then adjustment of occlusion. After that, we do adjustment of clasps, and finally providing instruction for the patients for the denture care and oral health care. So starting with the inspection of dental prostheses before inserting the prosthesis inside the patient mouth. The tissue surface of the prosthesis should be inspected and it should be free from acrylic resin nodules or specules that can be detected by running the finger over the tissue surface of prosthesis, and once identified should be removed with acrylic carbide bar. And an important note is after removing the nodules with the acrylic bar, we should not finish the tissue surface. Another thing that we should examine is the porosity in the acrylic resin, because surface porosity or internal porosity have so many drawbacks. It may cause weakening of the denture base material, so it will be susceptible to fracture. In addition to that, it may facilitate discoloration and staining of the denture base material. So, if we notice a porosity, the denture should be repeated from the beginning. Also, we should examine the denture teeth for any fractures and dislodgement, and also we should examine the junction with the denture base material if there is any debonding or cracks in this interface area. The other thing that should be examined before inserting the denture inside the patient mouth is the finishing and polishing of the polished surface of removable partial denture, which should be highly polished and with luster appearance without any surface defects to give the new appearance and minimize accumulation of plaque and calculus on these surfaces, because poorly unfinished prostheses have unfavorable effect on the denture, and this will diminish the patient-dentist relationship also. And as I said before, it will complicate the cleaning and the hygiene of the denture. The second step at the insertion appointment is to assess the acrylic resin denture base adaptation to the underlying supporting tissue. It should have an accurate fitness to the underlying supporting tissue without exerting any excessive pressure that may lead to discomfort and pain and soft tissue damages. We can check this by using a pressure indicating paste that should be mixed into a homogeneous mix, then applying a thin layer, not a thick layer, a very thin layer on the internal or tissue surface of the denture, then chilling the denture with the paste with a cold water before inserting into the patient mouth. This will prevent the paste from stacking into the oral tissues. After that, the denture will be inserted inside the patient mouth and digital pressure applied. In addition to that, we use a cotton rolls between the teeth and ask the patient to close on it. Then remove the denture. The pressure area will appear as in the third photo with the red circle. The pressure indicating paste will be whipped off from the pressure area. So we mark this area with indelible pencil. After that, we use an acrylic carbide there to remove it, as we removed the acrylic nodule and specules. And again, we should not polish this surface after finishing of removal of the pressure area. The third step is the assessment of the peripheral extension of the denture base. We should notice if there is any overextended border or underextended border, because each one of these may have so many drawbacks. Regarding overextended border, this may result in dislodgement of the removable partial denture during function due to the action of the muscles and frenum. Also, this may affect the stability of the denture. In addition to that, the overextended border may cause ulceration, pain, and swelling of the vestibular tissues, and may impinge on the muscles of mastication, which may interfere with the muscle function during mastication and speech. In addition to that, the overextended border may result in incomplete seating of the removable partial denture. So we can detect this by inserting the denture inside the patient mouth and place a light finger pressure with one hand, and we start a physiological movement with the lips and cheek of the patients, like when we do a border molding of the impression, but here we have a denture, and start the movement of the cheeks and the lips. And if we notice any dislodgement with the denture, of the denture from the patient mouth, this means we have an overextended border. We can also use a disclosing wax that's placed on the border and start the movement, the overextended border, showing a whipping of the disclosing wax. So we detect and mark the area, and we remove the overextended border or flange using acrylic carbide there, then finish and polish the border. While regarding the underextended border, it may result in inadequate distribution of the masticatory forces, as the denture base should cover the entire denture bearing area and supporting area. In addition to that, it may cause a food entrapment under the tissue surface of the removable partial denture, which may be annoying and irritating to the patient. Also, a prosthesis with underextended border may lack the stability and resistance to horizontal forces. The fourth step is the adjustment of occlusion in harmony with the natural and artificial dentition. In simple words, is removal of high spots. This is a very important step and may be time consuming if you have any defect at the previous steps of jaw relation registration or train stage. So here is a few points that you should put in mind that will help you in adjusting the occlusion and having a very well balanced occlusal contacts between the dentures and the artificial and natural teeth. So, if we have a contact between the maxillary and mandibular teeth, uh, what we call a vertical stop, we should take this as a guide during adjustment. So, before you insert the dentures, let the patient close at the centric relation and notice there should be no space between the upper and the lower teeth. Copy this in your mind, and you should copy this picture after inserting the dentures. So after adjusting the occlusion, you should have the same relation between the natural upper and lower teeth before inserting the denture and after inserting the denture. If there is any gap between the natural teeth after inserting the denture, this means that you have a high spot. This is a very important step, so I put it first. The other point is that we should insert one denture at a time. So we insert, for example, the lower denture, complete removal of high spots with the opposing natural teeth, then we insert the maxillary dentures. Then we check by inserting the maxillary and mandibular dentures together. How to check the occlusion? We should always ask the patient to close at the centric relation. Always at the centric relation. How to mark the high spots is by using an articulating paper or disclosing wax. After that, we remove the denture from the patient mouth and adjusting this using small burrs. We should try to keep the anatomy of the teeth as much as possible. In our clinic, we mainly use the articulating paper. Also, we must repeat this step until occlusal balance is in the planned intercuspal position have been established and uniform contact without any perforation are evident from the final interocclusal wax record if we use a wax. But if we use an articulating paper, we should have evenly distributed mark on each one of the teeth from the articulating paper marks. The other point is that using articulating paper or disclosing wax bilaterally, we should not put an articulating paper, a single one, on the right side or the left side alone, because the patients will have tendency to deviate the mandible to this side. So we should put it on the right and the left at the same time and ask the patient or guide the patient to close at the centric relation. And after that, of course, we should adjust the dentures at the eccentric relations. So here are photos of articulating paper that comes in the form of strips, like in the first photo, or comes in the form of U-shaped or horseshoe shape that can be placed on the entire arch at the same time. And the lower photo showing the mark of the articulating paper. In the first photo, we can see they use two articulating papers bilaterally at the same time and ask the patient to close at the centric then the eccentric relation. In the second photo, we can notice there is a balanced occlusion, a very well balanced occlusion showed by a mark of articulating paper on all of the teeth and at the same degree of a color. Well, in these photos, we can notice a defective occlusal contact. In the first photo, we can notice there is a contact or occlusal contact on the left side, while the right side showing a little or no occlusal contact, while the photo of the anterior teeth showing a single occlusal contact on the palatal surface of the upper right central incisor. So these marks should be adjusted until we get an even contact on each one of the teeth at the centric occlusion. Here's a photo of occlusal wax and the second photo showing bending of the occlusal wax and marks of the teeth. The fifth step is to adjust and activate the clasps of the denture using angle pliers or 139 pliers with one round cone beak and one triangular beak. We grasp the clasp and slightly bend it or adjust it at the level and to engage the undercut so we have a retention for the denture. The final step is to provide instructions for the patients and the denture care. We should learn the patient how to insert and remove the dentures, and he should practice this at the clinic in front of a mirror before we give him the dentures to take away to home. In addition to that, we should learn the patients how to care with the denture, and we should instruct him to be careful by using the denture and not to break the clasp arms. And we should inform him that he may suffer some discomfort and minor annoyance at the beginning, and there is possibility of development of soreness or ulceration despite every attempt on the part of the dentist to prevent this from occurring, because patients may vary widely in their ability to tolerate discomfort, and we should advise him to come and to adjust the denture at future appointments, as most of the patients need future appointments to adjust their dentures. Also, we should give him info that he will need at least a week to 10 days before your dentures feel as part of your body. And we should tell him that if you have any difficulty with the speech at the beginning, you should practice this by reading or talking loudly, and you will master the speech within a week or a few days. And it is normal to have difficulty with chewing efficiency during the first few meals, and we can facilitate this by cutting the food into small pieces and start with soft diets, then start with the bigger meals. Also, we should inform them that learning to use your new dentures will take a time and patience. Regarding instructions of the denture care and oral health care, we should instruct him that you should always keep your mouth and your dentures as clean as possible, and using a small soft bristle brush and non-abrasive dentifrice to clean your denture. And the tissue should be allowed to rest by removing the denture during sleeping, at night, or at any time of sleeping. Also prevent the denture dehydration and the subsequent dimensional changes by keeping your denture in water. So if you remove your denture from your mouth, keep it in water to prevent the dehydration and dimensional changes. Also, we should inform him that the follow-up is required, and we should inform him to avoid careless handling of the denture, which may result in distortion or breakage. Also, we should told him to protect his teeth from caries by proper oral hygiene, manners, and proper diet and frequent dental care. Also, regular and continuous care by both the patient and the dentist is required. Thanks for your attention, and if you have any question, I'm ready to answer it. Thank you.